I guess I wanted to talk to you about the Thinking Together program. So I'm, as part of my work with Health Education England, I'm leading the London offer for generalism. And I could have done this any way that I wanted to, except that there was no money. So it was kind of like, do whatever you want, but there's no cash. And so, everything you've said just absolutely resonates. And Jonathan as well. I think I've spent a long time as a GP kind of noticing all the people who get lost in the system, who are not listened to, people with the chronic pain who are just kind of pinged through the system, the unexplained symptoms, the kind of inefficiencies and lack of heart, I think, are person-centered care, social justice, population health, systems working, sustainability, and complex multi-morbidity. And I kind of wanted to center, to sort of focus on person-centered care and social justice, but systems as well. And so kind of come up with this program called Thinking Together, whereby trainees from different specialties, including general practice, come together and talk about these issues and then form a community between. That's the idea. So it's not just 2 course days, which we'll run several times from September, but it's also forming a community in between, doing some quality improvement work, and so that's the kind of model that I'm proposing. So I've been really lucky. I've come into contact with the most amazing people through this project. Many of you kind of here included, I would say. So we've had, I've had Caroline Schulman, who's the homeless medicine lead, speak at one of our pilot kind of courses. I've had patients, some of whom have been introduced to me by Jonathan, and I'm very grateful, Jonathan. They're amazing women, totally amazing. And a couple of patients with lived experience of homelessness, really talking to trainees about how they access the system. So, whatever pathways you have often absolutely fail these people, don't they? They're the ones who are digitally excluded, where the algorithms are really particularly problematic. And also how you engage with people, how you listen to their story. So a bit about narrative medicine. So that's the kind of course outline. I think people were hoping it would be a bit more practical, as in sort of, how do psychiatrists manage diabetes? But I didn't want to do that. I wanted to kind of think about how we are as practitioners more, and about how the system disadvantages certain groups. So that's the model, and yeah, I'm hoping it will take off and that people will will engage. I want there to be a culture change. I sort of saw this as a chance for a stealth, sort of slight shift in culture.